Hola, bienvenido a nuestro segmento Tu Belleza con el Dr. Roland. Hoy vamos a hablar acerca de la abdominoplastía. Lo voy a dejar con el experto, mi esposo, el Dr. Roland.
Buenos dias, good morning, and welcome to the Jackie Show. Today I'll be talking about tummy tucks, which the medical name for is abdominoplasty. This is a surgery that's very, very common, usually seen in women after they're done having their children, because it tries to correct some of the abnormalities that pregnancies can cause in a woman's body. Those are usually excess skin around the belly and also stretching of the muscles from carrying the baby inside the womb. The tummy tuck is easiest to think about as two surgeries in one. It's removing the skin and it's tightening the muscles. So the way the surgery is done is the skin is folded back on itself. The muscles are tightened from the breastbone to the pubic bone, so the muscles are back to where they were before the children, and then the extra skin is pulled down. The bottom of that skin is taken off, making a scar, and a new belly button is created in the same place. So the scars after a tummy tuck are a low scar, which is longer than a C-section scar, but in the same place down below, and a scar around the belly button. The recovery for a tummy tuck is about 2 weeks, and that's because of the muscle portion of the procedure. It's more painful, the muscle, than the skin, and it takes longer to recover. So people aren't encouraged to go back to their normal routine for at least a week and a half, usually 2 weeks. One of the things that comes up in the tummy tuck consults quite often is people come in with a big belly and they think plastic surgery is going to make that disappear, like an eraser. The problem is there are two kinds of fat on the belly. There's the fat between the muscle and the skin, which a tummy tuck helps, and then there's the deeper fat, which is around the stomach and the intestines and the liver, which a tummy tuck doesn't help. If there's too much of that deep fat inside, the doctor can't tighten the muscles. Because if the muscles are tightened, it's like squeezing toothpaste. If we squeeze the fat in the middle, the toothpaste comes up on the lungs and people have a hard time breathing. And that's never okay when it comes to cosmetic surgery. So these are the things that we look at when you come in the office to see what makes you a good or not so good candidate for this surgery, so that all of your options can be weighed and the right surgery can be selected so that you can have the results that you expect. The day of surgery, you come into the office, it's a private setting, and every patient is given my cell phone number. So during your recovery, if you have emergencies or problems, you call me directly. It's a lot easier that way than going through an office service in the middle of the night.
Con una abdominoplastía, la persona debe de estar en casa por lo menos 2 semanas. Ese es el tiempo que coge para que uno se sienta mejor. No se va a sentir 100%, pero se puede regresar usualmente a trabajar.
By and large, people get back to their normal routine by the 3rd week, but changes are still happening in your body for the first 6 months. Afterwards, we have you come back into the office and take post-op pictures so you can compare how you looked before to how you look after. This surgery isn't a weight loss surgery. It's a surgery to change your proportions to give you a nicer shape. The weight stays pretty much the same.
La abdominoplastía no es solamente para mujeres. Si un hombre ha perdido mucho de peso, también se le hace una abdominoplastía.
Como ven, con un poco de ayuda todos podemos alcanzar satisfacción física. Pero ¿qué pasa cuando olvidamos trabajar nuestro ser interior? El Dr. Roland nos habla sobre esto.
Today we're going to try something a little bit different on the Jackie Show. And it comes out of the concern that I've had with patients coming into the office with their problems. As you'd expect in plastic surgery, people come in complaining about the way they look, which this is why they come here. As a plastic surgeon, you have to look at those problems, figure out what you can fix, what's fixable, what isn't fixable, and hopefully be as honest as you possibly can. But the bigger concern that I've developed after all these years is people coming in without spending any time looking at the problems inside. They want all of this work on their bodies to pursue happiness and perfection, but they're not doing any work inside to try and make inner happiness and inner perfection. I can't stress this enough. You know, my wife Fatima and I have a large spiritual practice where we have our routines and things we do to get in touch with each other and with ourselves and with this universe we live in. And this has become a big part of who we are. And I really want to try to inject my practice with this spiritual component to try and help people not only outside their bodies, but inside their bodies. The most important thing in starting with is daily meditation. Most people say that they've tried it, it doesn't work, their mind is all over the place. That's all nonsense. Anybody can meditate, and everyone is meditating every day, they just don't realize it. So throughout this part of the show, we'll remind you of little daily tips and things that you can do to try to get in touch with that inner part of yourself, so that when you do make it into the office to talk about those problems and concerns, they're just problems and concerns. They're not insurmountable, they're not taking away from your daily happiness, they're not consuming you so that you're avoiding other parts of your life that need attention. That's my bigger goal for this show, so I hope you'll stay tuned. We have a lot more to come. Thank you.